I start, I would like to acknowledge some Manchester police officers that are in the room. I see a few of them there, as well as Chief Capano. The greatest honor of my entire professional career was serving alongside each and every one of these individuals and all members of the Manchester Police Department, so I'm eternally grateful. Chief Justice is here, and now I'm wicked nervous. Sir, great to see you. But good morning, and thank everyone for being here at the Manchester Community Health Center, for asking me to speak on issues and opportunities that are near and dear to my heart. The very day I was sworn in as a police officer, for my very last day, 29 years later, I always approached the job from a place that I came from, my childhood. My childhood would stay forever imprinted in me and would guide me to do all I could as a police officer to ensure that children who were present at calls that I went to, that I would be kind to them, considerate of them, acknowledge them, value them, carefully choosing my words while always being mindful of my physical presence. It's pretty daunting for a child who just experienced some sort of violent episode in their home to have this hulking police, well, not hulking, but to have this police officer, standing over them. It's intimidating. And I was always mindful of my physical presence as well as the way I behaved and carried myself. See, I had a hard scrabble life as a kid growing up, where police responded to my home often. Abuse, abandonment, neglect, domestic violence, alcoholism, and the shame that kids feel, whether you realize it or not, of living in abject poverty. As I've said, my childhood has been forever imprinted on me, with one particular reoccurring police response in which they were always coming to my home because my father would be abusing my mother. One particular time, a police officer had all 8 of us kids, me and my 7 brothers and sisters, line up on the couch while the other officer was dealing with my parents who were in the throes of a heated argument. As we watched on, my dad was told to leave and walk it off, and he would. And the officer would tell my mom to stop upsetting my father and you wouldn't be abused. So as us kids watched on, we were experiencing that toxic stress that I'm going to talk about a little bit later. But as the officers would leave without so much acknowledging us kids, not even being concerned of the bruises that some of us bore, I heard one officer say to the other officer, "These kids don't stand a chance." Frankly, I don't blame those officers today. I get it now. I understand. After being 29 years of a police officer, the experiences that officers face become frustration. But I did not understand it as a boy. I hated it, I resented it, and it only added to the shame I was already feeling within myself. But I went on and I performed my job as a copper from a prison where children mattered to me. So when I was named the police chief in July 1 of 2015, and by the grace of God, I had Chief Capano as my assistant, and I was now in a position that I could perform my duties not just from my personal beliefs and values, but I could somehow try to, I hoped, instill that concern, compassion, and consideration for children at scenes into the rest of the department. How I was going to do that, I had no idea, but I understood I had a pretty cool opportunity that now I'm leading an organization. And if they could see what's important to the police chief, maybe they would adopt some of those values. So I rose through the ranks and eventually became police chief, because I'm pretty cool. And all the while, I found myself thinking the same thing that I heard from my childhood. These kids don't stand a chance. I was no different than those officers. The difference in me, though, is I never said it in front of the children, and I tried to at least leave them with a shred of compassion as I went on to the next call. But it felt wrong, and I felt hopeless, and it wasn't the way I wanted to feel about the very kids that I was serving. They deserved better. But as police chief, I felt like I somehow have the power to make change happen, and more importantly, I had leadership within the agency that shared my compassion and care for children. Again, with Chief Capano by my side. Then, Sergeant Paul Thompson brought forward some exciting work. This is in my first week He's now a lieutenant, but then Sergeant Paul Thompson brought forward some exciting work that was being done in Manchester, led by the Manchester Community Health Center. And from Sergeant Thompson's initial research, coupled with the hard work of Lieutenant Nicola Dew, and the unyielding support of Captain Sean Layton, and again, Assistant Chief Capano, the Manchester Police Department was going to fundamentally change the way we view children who are suffering the toxic stress that occurs in nearly every single police response. Be it a domestic violence situation, be it an overdose in front of the children of a mother or a father, or even a SWAT raid, like that picture there, when a child is in the home. The work Lieutenant Thompson identified, Project Launch, was focused on helping children and families in Manchester by building capabilities or capacities of adult caregivers to promote children's healthy, social, and emotional development, to prevent mental, emotional, and behavioral disorders, and to identify and address behavioral concerns before they develop into serious emotional disturbances. It also focused on building collaborations among child and family serving organizations in our community, which is paramount. So we reached out to Project Launch. About a week after I started as chief, we had our first meeting with Laura Kyoga. I had to ask her how to pronounce that. Kyoga, right? I'm sorry, I'm serious. She's the Director of Strategic Initiatives for Children for Project Launch at the Manchester Community Health Center. And at that meeting, we learned about adverse childhood experiences, or ACEs. A growing body of research brought to light that ACEs are a critical public health issue. ACEs is the term used to describe all types of abuse, neglect, or other potentially traumatic experiences that occur to children. Studies show that the more ACEs a child has, the greater their risk and the more daunting their future. Children who experience ACEs are more likely to struggle in school, have emotional and behavioral challenges. Negative outcomes associated with ACEs include Manchester's growing health issues, alcoholism, substance abuse and misuse, depression, suicide, poor physical health, and even obesity. Other health-related problems, as well as academic and cognitive challenges, delinquency, and involvement in child welfare and juvenile justice systems are also associated with experiencing trauma. There's also some evidence that ACEs are linked to lower educational attainment, unemployment, and poverty. So I took the ACEs test, and I scored 9 out of 10. 98% of people like me suffer all the ills I just mentioned. I am an outlier though, because somewhere along the line of my life, there was some sort of intervention. Whether it's the Boys and Girls Club, whether it was a beat cop that was nothing like the cop that would come to my home, or whether or not it was a basketball coach. Somewhere along the line, each one of those people showed me that I had value, that I mattered, and that I should not be ashamed of the circumstances from which I live. Perhaps just showing a shred of compassion to a child at a traumatic call for service will be a moment in which the trajectory of that child could change for the better. Adverse childhood experiences result in exponentially increased risk of medical, mental, and social problems as an adult. And failing to address the trauma children experiences is setting them up to fail, not giving them a chance. But there is good news. The research shows that that these poor outcomes can be prevented if children and their caregivers have nurturing, responsive relationships, and if families are connected to the right services to mitigate the negative impacts of exposure to ACEs. Children's healthy development provides a strong foundation for healthy and confident adulthood, responsible citizenship, economic productivity, and a thriving community. So at the meeting with Laura, we also talked about the police department and what we were seeing. In 2014, we reviewed our data and found that more than 400 children had been exposed to domestic violence. That's just one call. That's one call for service, domestic violence. Not a child witnessing an overdose, not a child experiencing any other sort of trauma in the home or perhaps they're being abused. This is just domestic violence in the home in which children were present when it occurred. 400 kids. Following these incidences, the adult victims and the perpetrators received advocacy services or interventions of some kind. None of the more than 400 children received advocacy, referral, or any other compassionate means to help them navigate the stress they just occurred to them. So think 400 kids were invisible to the system. They didn't exist. They didn't matter. We go, we take the call, we lock up pot, we leave. The child is left to cope with what they just experienced. The father gets services, gets an attorney, the mother gets advocacy, she's helped through the system, through the advocates. The child gets nothing. Sadly, we were seeing children who had watched loved ones collapse in front of them from an overdose, or a parent getting arrested for domestic violence. And our hands were tied to provide them with more than a brochure, a phone number, or to call Child Protective Services. So these 400 children at least have one ACE, one, we know, because they just witnessed violence in the home. And I can guarantee you they're going to top out with a minimum of 8. I've been to enough calls to know. So we're now pointing them down the roads towards poor mental health and behavioral outcomes. The police department, frankly, is not equipped with the tools that other agencies have to help children and families in need of services. Connecting with Project Launch and its well-established collaborative partners made absolute sense. In short order, we pulled together community partners. Many of them are here today, including the YWCA, Southern New Hampshire Services, CREATE, the Division for Child, Youth, and Family Services, Easter Seals, New Hampshire, the Mental Health Center of Greater Manchester, Waypoint, Manchester Health Department, Elliott Hospital, the Moore Center, the Manchester School District, and so many others. And I apologize if I'm not ticking off your name. But everything that you do to help us in this collaboration, I'm eternally grateful for. We put our heads together to figure out what could we do. Our first moments were around the challenges of brochures. We were all tired of handing out brochures to the family and hoping that the family would call us back. It would be great if we could somehow come up with something to facilitate some sort of willingness of the family to participate. So what we did is we created a release form that patrol officers would carry with them, and if they came across a situation where a child was exposed to something traumatic, such as domestic violence or an overdose, the officer could then ask the parent to sign a release, giving the police department permission to share the information about the incident with the appropriate community agencies. That agency could then directly call the family and start intake services. The release idea worked, but only at first. In the first 2 weeks of using it back in October of 2015, we had about 20 releases signed and referrals made. But then it sort of fizzled out, like everything does when you're trying to do a new initiative. We had done the right thing in coming together as collaborative partners, identifying the needs of our community and trying something to address it. We quickly learned, however, that we had identified a simple solution to a complex problem, and we needed a more proactive approach to engage families. We needed positive interactions and human connections, not just a paper shuffle. So the police department, the Manchester Community Health Center, and the YWCA met again. We talked about what other communities in the United States were doing to connect children with services, but none of them seemed to fit our needs here in Manchester, and our vision to address adverse childhood experiences and prevent later poor health and behavioral outcomes. Nobody in the country was looking at it as we were. So after more research and discussion, we had an idea of a new kind of team. The police have experience working as part of teams for intervention when a crime has been committed. For example, the domestic assault response team and our sexual assault response team. So the police department is good at having teams responding to victims. So this was about prevention and children. We needed to put the same energy into addressing the needs of children who are at risk that we put into treating adults battling addiction, committing crimes, or suffering from direct victimization at the hands of somebody else. We created a team made up of a police officer, a crisis service advocate, and a community health worker. The team would respond to incidents in which children were exposed to trauma as soon as the scene had been secured by the officers who had responded to the call. Police officers at the scene would continue to offer parents the release form for the program, but the team would assess the situation and determine next steps in real time that could be taken for the children, such as support groups, mental health counseling, early childhood education, or child-parent psychotherapy. The concept of the Adverse Childhood Experience Response Team, or ACERT, was then born. the Manchester Community Health Center applied for funding to the New Hampshire Health Foundation in May of 2016. We received funding to support the team operations and training for the next 3 years. In June of 2016, we brought together 45 ACERT staff from the police department, the Manchester Community Health Center, the YWCA, and trained them in adverse childhood experiences and trauma-informed services, an approach which attends to victims and survivors, emotional and physical needs, as well as ensures that they have access to advocacy services that are nurturing, destigmatizing, and non-re-traumatizing. So, July 7th, 2016, just 2 days shy of the 1-year anniversary of our meeting, we launched ACERT. I was waiting for Adele to stop the clap, and she didn't get my cue. So the team goes out 2 nights per week to respond to live calls or to follow up on previous incidents. That same release form that we started with is still an instrumental piece of our collaboration that allows us to appropriately share information to connect families to services. ACERT is responding to a variety of incidences in which children are exposed to trauma, domestic violence, overdoses, sexual assault, suicide attempts, and swap rates. As you saw in the picture, we go to a SWAT call. We certainly try to do everything that we can when we're breaking into somebody's home to make an arrest and shut down the drug house, to get the information to ensure that children are not in the home. The last thing we want is for us to do a dynamic SWAT raid of an address with a child in the home. So picture that little boy and the services that he was provided instantaneously that day, and how just in that moment, we're already starting to change the trajectory of that child because of not just the conditions he'd been living in that prompted us to raid the home, but also to work through what it meant, what he just went through when a flashbang is set off outside the window, and then the door is taken off its hinges, where the police officers have to go in there in a dynamic fashion because these are dangerous individuals. That little boy got services in real time. ACERT has been accomplishing what we hoped it would, and after nearly 3 years, ACERT has responded to more than 1,400 calls for assistance with families of children who have been exposed to trauma, abuse, or violence. The team has deployed over 250 times and referred more than 3,000 children of all ages to services. 1,000 people. There's 1,000 children that were otherwise invisible just 3 short years ago. Today, they matter. Today, they're getting help. And when I say invisible, they were invisible. I know what it's like to be invisible at a call for service when the police show up. So today I'm happy to watch ACERT expanding under the steadfast leadership of Chief Carlo Capano and the enthusiastic support of Mayor Gregg. Communities in New Hampshire and other states are now working to replicate ACERT, and I think you'll see it in Laconia and Concord next. They have applied for funding to sustain the team. The funding will help the team expand in Manchester as well. The funding will also expand to the Manchester Fire Department and American Medical Response and Safe Stations. Police officers, firefighters, just like police officers, often go to these calls where children are present and police aren't responding. So the same goes for what they're seeing and what the children are experiencing when a police officer or AMR the fire department or AMR come to the home because mom or dad just took an overdose and collapsed. Pretty traumatizing. So they're going to do the same thing that we are doing. These organizations are seeing situations and families that police don't necessarily encounter. ACERT will double the number of shifts per week. ACERT will provide training to all of its first responders and trauma-informed services, and we realize that with connecting to more children and families needs to our community, such as the Mental Health Center, Waypoint, Create, Upreach Equine Therapy, could face capacity issues. So these social services that we're referring kids to, like the equine therapy, is just fantastic. But they're gonna get to capacity the more children that we send their way. So therapy could face capacity issues, so we're ensuring that they have additional resources to continue offering services and meet the needs of the community. We're also connecting with the Manchester School District, helping administration become trauma-informed, providing consultation to teachers to ensure that they're supporting children appropriately after experiencing a trauma. So a child comes to school and his hair is a mess, and he's dour and he's sullen. And a teacher now knows, well, I know last night there was a pretty bad domestic at the home. And now they have a mindset, they have an understanding of what that child is dealing with. And then they, just by the way they treat them, again, they're giving these kids services. As you go along in life, the child that's living with these ACEs, every single moment that's kind, caring, compassionate, considerate, that weaves the child to become a completely different person, so long as it continues and it's continuous. So having teachers know what happened to a child at their home last night, and the parents being okay with that information being released, I think it's just outstanding. Community collaborations are what it takes to address the challenges facing the most precious and vulnerable among us. Collaboration is the best mechanism we have to change the trajectory of children's lives. Through collaboration, we are able to provide early intervention to the entire family following a violent or traumatic event, significantly improving the child and the family's potential to succeed. If we truly want to change the outcome of our vulnerable children, we must work together. Everybody in this room. Together we can change the outcome of our kids because we can help them and the adults in their lives to have access to necessary medical, developmental, and educational resources. Our collaboration worked because we created a shared vision and plan among a variety of community members and sectors. Everyone's egos were left at the door. It allowed us to identify and implement needed services to better address the needs of children and families. It enhanced our relationship with each other and increased positive interactions with family. This worked, and all of our collaboration worked because we came together as a community. We were one. It's an exciting partnership between the public and private sectors that help children function better in school and make Manchester a better place to live. The Manchester Community Health Center, Manchester Police Department, the YWCA, and all of our community partners formed a strong team. We figured out that strong agency collaborations, cross-sector partnerships, training in ACEs, and trauma-informed services were the levers we could use to make changes we would want to see. We knew that if we could respond to families in crisis and link them to services and opportunities, that we would be building protective factors such as parental resilience and knowing where to go with concrete support in times of need. And in the end, we are building stronger and more resilient families. We are mitigating the effects of ACEs, and our kids do stand a chance. These kids don't stand a chance. And may there never be a moment when a police officer feels that in his heart, or utter those words, certainly not in the presence of a child. Thank you.